Thanks for staying tuned. Breast cancer is the #1 cancer killer of Nigerian women. 3 independent studies recently published have linked a high intake of red meat such as suya, kwabi, kilishi, isewu, bacon, bushmeat, and steak to cancer. Given our dietary intake in Nigeria, these studies are very much unnerving. Joining us to educate us better on breast cancer is a medical practitioner, Dr. Femi Olaleye.
Good morning.
Thank you for joining us, sir.
Thanks for having me.
You can join into this conversation because breast cancer is an issue that everyone wants to talk about by calling 07080668014 or tweeting to us at YourViewTVC. Sanzi will be reading our tweets. Breast cancer, prevalent, almost every household these days. Why?
Well, 2 reasons for that. One, it's the commonest cancer that's affecting human beings. Women, sadly, you have a pale breast. So if it's not 1, it's 2. So it's just numerically, and there are more women in the population. So it's #1 cancer. But it shouldn't be the #1 killer of women if women can do 1 or 2 things. One, they know that their breast, in quotes, can kill them. So they should be proactive in preventing these cancers. You alluded to a published study. There's still a lot of argument and controversy about that.
I love all this.
No. Don't panic. It's scientific studies are not designed that way to create alarm and stuff like that. So I'm sure it's just sensationalism, as it were. But from a point of view of prevention, every woman, whether you eat kilishi or you don't eat kilishi, you're at risk. Because the cells in the breasts are made up of 2 tissues. We call them ducts and the glands. Don't let me go too medical on you. But basically, those 2...
We've always had women with breasts.
Yeah.
Why is there a prevalence of cancer now?
No, it's always been there. And just off here, we were having the discussion earlier that it's always been there. It's just that now more women are talking about it. Kudos to you ladies, you're bringing it up on here on a topical
We've
topic.
had it before,
and you don't stop.
Yeah.
You know, and on churches now people are talking about it, pages of newspaper, people are talking about it. And more importantly, people who suffer from breast cancer don't cover it up anymore. They talk about it. They even use themselves as a sort of awareness, advocacy, and all of that to other women. And kudos to a lot of women. More women are turning up for screening, and therefore we are discovering it a lot earlier, and therefore we are able to save a lot more women. And I'm very grateful that media organizations like yours are always giving support to organizations like ours.
Okay, we eat red meat a lot, especially in Nigeria. It's our delicacy.
Yeah.
What alternatives do we have?
Which is why I don't want you to get hooked on this study. It's just an alarmist study.
Okay, so what can we do to prevent?
Every woman that has a pale breast must look for a lump in her breast. As I was explaining to you earlier, the breast of a woman is made up of fatty tissue. Inside those fatty tissue are the glands and the ducts, and the cells, they just keep on multiplying. They've lost their ability to die. And that is how cancer cells establish. So a woman who knows that something can possibly go wrong in her breast, should potentially look for it. And I'm going to teach you ladies, and I'm sure the viewers at home are going to watch. Nobody's going to take off their jackets, don't worry.
You must have seen fear on my face.
Exactly, and the guys are already rubbing their hands.
Sorry.
So ladies, let's quickly do this. Sorry,
Okay.
Ajay, I'll come to you in a minute. Raise up your right hands.
Okay.
Right hand, because you're going to use the right hand to examine the opposite breast. And yes, drop the pen. That would be a very good one. No thumbs. So, because if you use your thumb, it's going to confuse you. You're going to end up doing something like this. And they go, oh, I don't know what I'm feeling. So, no thumbs. So, the second rule is to bring that right hand to the opposite breast, which is your left breast. And that area you're touching, we're going to call it the 12 o'clock of your breast. The nipple being the center. So, you're pressing that 12 o'clock. And ladies, you can answer this question as you're pressing right now. Is this soft or hard?
Soft.
It's soft, yeah.
Ajay, I didn't even have to touch.
I'm touching.
You cheated.
I'm not cheating. I'm touching already.
You're touching underneath.
I'm touching.
All right, good.
Dr.
So I haven't found quickly that
It's
it's
important
soft.
to me. You don't know how important.
Yes, I haven't found that it's soft. You go around 3, 6, and 9 o'clock. If there's a soft lump, a small tiny lump in your breast, you will feel it. The woman will feel it. And then she comes for checkup. She goes to her pastor, they pray over it. She snaps her hand over her fingers and says, not my portion. All of that. But she must find it first. Women who don't do that are the ones who discover it late.
Late.
And it is the late detection that kills women.
Okay.
So I was going to
Management.
ask before I had to wait that how regularly must she
Every
check?
month.
After
Every
you
month.
have even found, how do you manage breast cancer?
Every month. Every woman that has found a lump in her breast, and I'm sure lots of women today will find lumps having done this, don't panic. It's not always cancer.
Okay.
80% of the time it's benign, non-cancerous. Okay. Have you heard of fibroids of the womb?
Yes.
You've got fibroids in the breast too. And that's the commonest
really?
type of lumps women will find. Lots of women who turn up at our center, we don't find cancer. But we don't know who that those 2 out of 10 are. So every woman has a lump in her breast, must check it out. Don't assume, oh, it's not paining me, so I'm going to leave it. That might just be the one that is going to be cancerous. So how do we manage them? We first of all make a diagnosis.
Yeah.
Find out that is it cancerous or not. So we do mammograms. For women over 35, if you're younger than 35, we ask you to do a scan, like you do pregnancy scan. If we can confirm that indeed something abnormal is growing there, we do what we call a biopsy, a needle biopsy. We just take a needle in there. The way you do a blood test, we just do a lump. I call it a lump test for the women. Then they confirm, oh, madam, thank God, this is just benign. We don't.
What if it is cancerous?
Okay,
I don't like talking about if it is cancer because that would take us a whole day. Managing cancer is a big problem. Most women want to find out it is not a cancer. So once I've done that, they say, madam, leave it there. You have an option of leaving it because it doesn't turn to cancer. However, if it is a cancerous lump, this is where we have a challenge. Public health systems and as a country, we do not have enough resources to manage our patients. Financially, it is expensive. 2 levels of care are needed. One, you have to physically remove it, so there's surgery. And because those women who we are seeing always turn up late, the only surgical option available to surgeons is to actually remove the breast, which, as you know, is disfiguring, has an emotional, psychological impact on the woman, and of course the financial implication of that, because it's a major surgery. And therefore, all attempts, all efforts should be made to prevent it. So that if you catch it when it's still tiny, it's just a people will call it lumpectomy, just removing the lump that might be necessary.
Okay.
And after the woman has had surgery, there's chemotherapy, whereby you have to give injections into the vein of the woman and make sure that the cancer probably could have spread out of the breast to the bone, to the lungs, it's captured and killed as well. And of course, there are not many women who can afford that. There are not many centers where that is happening. And lastly, if that is not helpful, we can do what we call radiotherapy, whereby a blast of killer radiation is focused on that area. We're supposed to have about 5 radiotherapy centers in Nigeria. Probably 1 or 2 are working.
Wow.
And they're overworked, 1 in Ibadan and 1 at Nsukka. And lots of women wait for months before they get their therapy. So women, please check.
Prevention
is the key.
detection.
Early
I
detection
just
is
want to
key.
quickly throw in a question, Jumoke, because one of the reasons why a lot of people are so scared, myself inclusive, are so scared of cancer is that it's fatal.
Yeah.
Now, what are the chances of survival? Probably when you detect it late?
Yes. In fact, the study has shown consistently that if a woman detects her own lump herself and is found out to be cancerous, she has almost 100% survival rate. Almost 100%. That's why this is worthwhile. I'm sure we all joked about this 10 o'clock, 3 o'clock, 6 o'clock, 9 o'clock.
I've forgotten. The last time I was with you was the last time I did the
Oh,
test.
thanks. You've come along before. Yes.
So do you have free?
Yes, we therefore make sure women turn up every Friday. We make it free.
Wow.
Free,
And you
FREE,
learn a lot. I
and
learned
we
a
do
lot.
I love
seminars.
freebies.
Thank you very much. And again, we're thankful to a lot of organizations that are supporting us. But I need to quickly mention this. This Friday, 27th of June, 3 days from now, a woman passed away. It's an anniversary of her death from breast cancer. And her family decided that it's not worthwhile getting everybody around to eat rice and chicken. They will use that money to support women who would need mammograms and free screening. So yeah, a round of applause for their family and good kudos to the family, the Atta family, Iche Atta. So women, if you can find your way to optimal cancer, I hope I'm.
You go ahead. We'll even
please.
tweet it.
Thank
Since
you.
it's free.
I don't want somebody sending me a bill later. Optimal Cancer Care Foundation, 118 Bode Thomas Street in Surulere. It's quite a very open road, so you find us easily from 10 o'clock in the morning till Well, 4 o'clock, because we need to finish on time. First come, first serve, you get screened. The Atta family, we are very grateful for them. They'll pay for some mammograms that day. They'll pay for some those who will need treatment, because we'll be doing both breast and cervical screening as well. And every Friday, even after that, women are expected to turn up and do
We
screening.
still have so many questions
So many, even on
unanswered.
Twitter.
So we will have to bring you back sometime to ask, because,
Absolutely.
you know, we can never finish talking about this.
I
you
know, and I will appreciate that.
But what we will do today for
Yes, ma'am.
people who want to reach you directly is to tweet your phone number, the address where they can come to on Friday,
And our
all the
Twitter-
details.
and our Twitter and
you know.
Facebook
Thank you
page.
so very much,
Thank you for
Dr.
having me,
Femi
ladies.
Olaleye, for coming.
Thank you
Thanks,
very much.
ladies, for joining us on the program this morning. You can please watch a repeat broadcast of your view at 11:30 p.m. today. You can also watch repeat episodes on YouTube by going to youtube.com/TVC Entertainment and search for your view. We'll never stop saying we should stop terrorism in Nigeria, say no to insurgency, and yes to a peaceful country. Thanks for watching. Please keep a date with us tomorrow. Have a great day ahead. Bye for now.